Good afternoon, everyone. I'm Dr. Avinash, Pediatric Surgeon Pediatric Urologist at KIMS Cuddles, Secunderabad. Today, let's have some chat about abdominal pain. To be more specific, it is recurrent abdominal pain in children. So, abdominal pain is taken very seriously by the parents due to its severity of nature, as they cannot see the child with suffering with abdominal pain. And as we know, abdominal pain has a lot of variety of conditions which are very serious to take and sometimes life threatening. So abdominal pain is considered very seriously both by the children as well as the parents. And to be more precise, even the doctors, we as pediatric surgeons, most of our outpatient department, we have a lot of abdominal pains. Maybe they may be acute, that is, they develop within a short duration, or they may be chronic, that is recurrent. They may be having recurrent abdominal pains. So coming to recurrent abdominal pains. So what is the definition? We have guidelines where the recurrent abdominal pain is pain which is there for at least once a week for more than 3 months. So when the child is having pain every week and he's having it for simultaneously up to 3 months of timeline or above more than 3 months, it is considered as recurrent abdominal pain. So how prevalent it is in our society, where we see that abdominal pain is generally seen in around age group of around 4 to 12 years, and around 10 to 20% of the children do experience these recurrent abdominal pains. So it has a major impact on these children, as because recurrent abdominal pains, the children, they lose their schooling, and they are generally having absenteeism from the school. So this causes a major concern by the parents, and even the children nowadays, they don't like to miss their schools. So what are the common causes of recurrent abdominal pain? So recurrent abdominal pain, we have a certain set of causes. One, we classify it as organic. Organic in the sense, yes, there is some problem in the stomach which is causing a recurrent pain abdomen, or functional. Functional in the sense where there is no organic cause, that is, there is no abnormality, major abnormality detected in the abdomen, but because of some neuronal or neuronal disturbances and nerve disturbances, which are, they are more sensitive. Kids are sensitive, their mucosal linings are sensitive, they experience these pain, and which is recurrently happening like this. So coming to the organic causes, like organic in the sense where there is a problem within the stomach, we can classify it as gastrointestinal. Gastrointestinal in the sense it is from the gut. So most of the kids who have recurrent abdominal pain may have one what is called as acid reflux. Though we generally tend to see this acid reflux in adults, but trust me, it is really common in kids also. And thanks to today's lifestyle changes as well as the dietary patterns, with acid reflux is more commonly seen nowadays. So acid reflux, yes, definitely it is one of the most commonest cause of recurrent abdominal pain, where we see the pain in the epigastric region, where they say they have a pain in the chest region. And the second common cause is chronic constipation. Yes, most of the parents, they do complain, come to our OPs and complain that the child is not passing stools properly. He passes once in 3 4 days, or they pass very hard stools. So these children, they tend to have recurrent abdominal pain. There are multiple causes of constipation, like poor intake of water, and a poor intake of fiber diet, because today's food habits have changed completely, and there is hardly any amount of fiber which the kids are taking nowadays. So because of that, they tend to develop constipation, and most of the kids nowadays are still indoors. They don't have a proper physical activity, so this is also leading to for chronic constipation. So chronic constipation, yes, is one of the major cause for chronic abdominal pain, which has to be taken care. And the treatment aspects is much simpler, it seems, but it is not very easy to deal with, and I will come to it a little later. And the third common cause is sometimes the urological causes. Like urological causes are where the child may have difficulty in passing urine, or he has difficulty in uh, that, as I said, difficulty in passing urine, that is micturition, where sometimes these people have recurrent abdominal urinary infections, and these urinary infections can cause recurrent abdominal pain. And most of the times, these kids, whether if it is boys, they do have certain conditions called as phimosis, where they cannot retract the prepuce completely and they develop urinary infections. And urinary infections are very common in females also. And as these kids, they use share the common lavatories in the schools as well as outside, so they tend to develop more commonly these infections, causing recurrent abdominal pain. And not very common in our country, there's lactose intolerance. We do see lactose intolerance is one condition where uh, the we have a deficiency of an enzyme called lactase, and this causes a lot of bloating and other type of symptom complex, and this also causes recurrent abdominal pain. So one of the dreaded disease, like we commonly see, appendicitis. See, appendicitis can be acute, that is, may develop within 2 to 3 days or 4 days, and they have certain other symptoms like fever. We call some red flag signs. So the fever, and they may develop vomitings and all. So this is a typical picture of acute appendicitis, where if sometimes when treated or it goes unnoticed, they have a subclinical response. They go to a condition called as chronic appendicitis. So chronic appendicitis, what we see, most of the kids come, they say they had this pain abdomen 2 months back or 3 months back, or sometimes 1 year back also, and it subsided, and again they are developing it again and again and again. So what we see is most of the times when they go to the doctor, they are getting some antibiotics and good painkillers, so it is responding a little, but it's still there is some subclinical chronic appendicitis going on. So this chronic appendicitis is one of the major cause in kids, causing the recurrent abdominal pain. So how do we treat this appendicitis or chronic appendicitis, whether even if it is acute appendicitis also? Nowadays we do what is called as laparoscopic appendicectomy, where we use keyholes and we have long instruments which we can remove. It is a type of minimal invasive surgery, which we have adopted from the adult surgery, and we do this successfully with laparoscopy, and we have a very small scars, and we can discharge the patient or the child within 2 days. So in females, there is one common condition like ovarian cyst. So nowadays we are regularly seeing children like around prepubertal and pubertal age groups, which are who are having this ovarian cyst, generally large enough to cause torsion, where the cyst completely twists around its base and causes torsion, which has and again it detorts. So there is a type of chronic abdominal pain, on and off, on and off. This process is going on in the body. So this is also one of the condition which is more common nowadays, and it has to be fixed, because this torsion sometimes it may not detort, or it may sometimes perforate or burst, causing more dreaded complication like peritonitis and other things. So it is a surgical emergency some of the times, and sometimes we incidentally detect ovarian cysts before they even cause any symptoms, and we can address it on an elective basis. Bands and obstructions, though it is more into the actual deeper into the subject, but most of the times the children who have these bands and obstructions, partial obstruction, they come to us with chronic pain, abdomen on and off, not settling, sometimes settling down, and sometimes having vomitings, and they don't take food properly, and this happens over a period of time, and it keeps on continuing for a period of time, and we somehow detect incidentally, or sometimes we do some scans which we can detect these obstructions, and sometimes they are also present acutely. So these chronic conditions, sometimes it may go into acute phase and we detect them. and this can be surgically treated, and it has a good prognosis. One common condition which is seen as malrotation, where we see the gut, the our intestines are generally fixed in a proper way and to function in a normal pattern, but sometimes there is some genetic issues or some developmental defects where the gut doesn't properly fix, and this what happens is it can twist and untwist and causing this recurrent abdominal pain, and not the child is not thriving well, and it happens though we generally detect it very early. Some kids we tend to detect it at a later part of life also. So intussusception is one common condition where you see most of the times when the child has recurrent pain abdomen and excessive cries in infants or little elderly also. What do we get regularly? We come with the scan report as intussusception. Intussusception is a condition where one bowel loop goes into the other bowel loop. Most of the times it is transient when it comes out, but sometimes where it requires a surgical intervention when it doesn't come out, and it causes a lot of discomfort to the kid, and sometimes there are some red flag signs like passing motion, blood in motion, and causing recurrent vomitings where we have to do in acute manner. So how do we diagnose these problems? Like there are a lot of conditions, and how do we diagnose? Before that, I would like to emphasize more on one aspect, that is the functional pain abdomen. Yeah, all these conditions which I have told earlier are organic causes. That is, there is some problem and we can treat it. So it is like a mathematics. So one plus one is two. So where we can find a problem and we can get the solution. Whereas one major problem is a functional pain abdomen, which is one of the most differential diagnosis for a recurrent pain abdomen. So this functional component is what we say when we don't find any cause. Like we do all the tests, we do a lot of scans where we see the child is having nothing in his stomach or abdomen, and but still they have this pain. So there are few causes for this. One is a genetic cause where their nerves are little sensitive. They have a sensitive stomach, so little bit of irritation in the stomach and they can perceive it as a severe pain, and definitely, and this is very distressing for the child as well as the parents. So how to treat these functional disorders? Like generally most of the times uh, we treat them on a most of the times it is just the behavior therapy, and we can just sometimes treat them with basic antacids and placebo treatments also, but most of the times they pass away with time. So before that we diagnose it as a functional pain abdomen, we have to go a process known as the diagnostic evaluation. So once a child comes to us with recurrent pain abdomen, so we ask the history, and like how is the pain, how many times does the child get the pain, and since how long is the pain, whether the child fits into this criteria of recurrent abdominal pain, and any other associated symptoms. Like most of the time we can call some red flag signs like recurrent vomitings. So vomitings with pain abdomen is not considered little functional. There should be some issue, and this vomitings can be green color also, which is generally green color vomitings are considered surgical until proven otherwise. And sometimes child passes stools with blood, so that is also a red flag sign. And the other red flag signs are if there is any weight loss. So sometimes there may be associated pain abdomen with weight loss. So in India, it is most common. Like we have tuberculosis, that is TB abdomen, generally seen with recurrent abdominal pain. There is loss of weight, and baby becomes very thin, and is they're not thriving well. So we tend to diagnose as TB abdomen, and that requires a typical treatment for it. And very rarely we do see cancers affecting the stomach. So the tummy where different organs can be affected, and we see some bumps and lumps over the abdomen. So that is also one red flag sign which we have to immediately consult the pediatric surgeon. So laboratory tests, coming to laboratory tests, some basic tests we can see if there is any infection process going on. So to see any infections going on causing this recurrent abdominal pain. And imaging studies, definitely first, nowadays the choice is ultrasound abdomen, where we can see any pathologies in the appendix or kidneys or anything which is very sensitive. Ultrasound abdomen, it's a first line, and most of the diagnosis can be got through the ultrasounds. Very rarely we do require CECT abdomens, like CT scan abdomens, where there is some diagnostic dilemma in the ultrasounds. So uh, after the diagnostic evaluation, like what do you have as a treatment options for these chronic abdominal pains? So as I told you, most of these chronic abdominal pains can be functional as well as organic. Organics, as we told, most of them they don't require surgery in these recurrent abdominal pains, but very few conditions, as I already discussed previously. And coming to one of the most commonest recurrent abdominal pain, which just requires only medications, is mesenteric lymphadenitis. Nowadays, it's seen very rampant. So these mesenteric lymph nodes are actually the barriers in the stomach, which are barriers to the bacteria and the viruses. So by the innate nature, what happens is they filter the bacteria and virus and they become big, causing a stretch and causing recurrent abdominal pains. So most of the times it is very irritating for the parents as well as the doctors also to treat this mesenteric lymphadenitis, uh, since it is has a long course and it has a waxing and waning type of course. So and how do we treat all these conditions, since we know that all these conditions are most of the times treatable with medicines, and lifestyle modifications comes first. So today's dietary patterns are changing, and more and more junk is getting into the diet. So what happens is there is less fiber in the diet and less water intake, causing constipation. So and also this mesenteric lymphadenitis, because a lot of outside food and junk food can cause a lot of intestinal infections, causing these mesenteric lymphadenitis and recurrent abdominal pain. And my sincere advice is to have proper lifestyle modifications, like they should have proper sports time, and they should be outdoors. Most of the kids should be outdoors for a specific period of time. They should have a lot of water, and fiber intake is a must for all the kids. Each meal should include a certain amount of fiber as well. And behavior therapy, yes, behavior therapy is sometimes when the kids are too sensitive, and though then they don't have any other problem in their stomach, and they're little sensitive, we can add some behavioral therapy. We can ask them to having a rewarded therapies, or sometimes we can ask them to have a book or a diary, food diary, where certain types of foods can trigger their pain, or sometimes we can identify them and avoid these things. So most of the times, these non-pharmacological treatment, that is without the medicines, the lifestyle changes, behavioral therapies, and all dietary changes, we can manage. And sometimes, yes, definitely, once you come to a doctor, what the parents think that their kids need some medications for these conditions and recurrent abdominal pain. Yes, definitely, the kids get better with certain amount of medications. Commonest medications what we generally give are antacids when there are acid reflux. So we give for a prolonged period of time, around 1 month, 2 months, and most of the times the kids settle down with these antacids if they have acid reflux. And better if the children are lactose intolerant, we try to avoid foods with lactose, and this generally removes their symptoms as well. And if certain amount of painkillers and antispasmodic drugs are given for a certain period of time, and which relieves their suffering, and they are all safe and we can use them. And a little elderly kids who are really having a lot of anxiety associated with this recurrent abdominal pain, or they are stressed out, and certain low dose antidepressants can be added for these kids also. So, as I already told, the role of nutrition and diet is the most important thing for recurrent abdominal pains. So, these pains are functional pains. Lot of fiber in the diet should be added, and lactose free diets, if the children are lactose intolerant, can be avoided. So, managing these abdominal pains, recurrent abdominal pains, are multidisciplinary. Yes, definitely. It starts with the pediatrician, generally is who are the primary point of contact, and later the surgeon comes to the role where to rule out any organic causes. Yes, definitely organic causes has to be ruled out. And if there are no organic causes, then functional pain abdomens, yes, definitely with initially with the dietary modifications and behavioral therapy, and later to pharmacological therapy. And especially family role is very very important in this. And most of the parents are stressed out because of the recurrent pains. They start avoiding school, and they have absenteeism, and this causes a lot of stress to the kids as well as the parents. So parents should take a step ahead and try to calm their children, and uh, get the proper medical care, and go ahead. So, any questions? I'm ready to take. So, Mr. Ritesh Desai has said that what are the red flags for abdominal pain? Yeah, abdominal pain associated with vomitings or loose motions, there's loose stools. They have to be considered as red flag signs, because generally they are, most of the time they indicate infections. And vomitings in green color, they indicate certain obstructions, that is, it's a surgical emergencies. And passing motions and blood in motions, this is also considered as a red flag. And weight loss, yes, definitely the pain abdomen with weight loss is sometimes can lead to some malignancies, and severe infections like tuberculosis also. So which medicine is best for stomach pain for kids? Yeah, medicine in the sense, as I already told, like we can start with basic analgesics like a paracetamol or cyclopam, which is most of the nowadays most of the parents do know these drugs. And if they are not subsiding with them in one or two doses, so I suggest them to immediately meet the primary care pediatrician or a pediatric surgeon. And then we can identify the problem. If it's some organic pathology, sometimes acid reflux, then we can do a targeted therapy and control the symptoms. So how can we manage the pain at home? Yes, initial medications like paracetamol and cyclopam can be given for one or two doses over a period of 4 to 6 hours. And if it is partially subsiding, then we can think that it is somewhat it can be managed. But as I told you, after the one or two doses of these medicines, and with some red flags, as I already mentioned before. So kindly don't wait till it becomes more severe, and kindly visit the primary care physician. One person says, why does 3-year-old have recurring stomach pain? Yeah, as I already told you, this 3-year-old, they fall into these criteria most of the times if they don't have any organic pathology to the functional recurrent pain abdomen. And this is mainly because of their diet inadequacy, and they don't take a proper fiber diet, and they have these mesenteric lymphadenitis on and off because of outside food or improper food. And can be managed with oral antacids and analgesics. So one question is, what labs are done for chronic abdominal pain? Yeah, most of the times laboratory we role is not much. We can just see that if there is any chronic ongoing infectious process with regular blood counts and all that, and sometimes issues with some pancreas and all, like we can do some amylase and lipase and all that. But otherwise, not much of a role in the laboratories. So, what is abdominal pain that comes and goes? So, abdominal pain that comes and goes, yes, definitely it is. Most of the times, it can be a functional pain abdomen, and generally can be managed with some medications. And as I told you, if there are no other red flag signs, so those red flag signs are very important, and they are not there, then yes, definitely we can manage. So one of the person has said that my child is getting frequent stomach pain. When we consulted our home doctor, he said there is nothing to worry about, but the child's growth is not good. So doctor, can you suggest anything about this? Yes, definitely. This recurrent abdominal pains, as already told, they can lead to absenteeism from school, and they alter the daily natural life of the kids, because most of the times they are in pain and they don't tend to take proper food. So what we have to do is, first thing, we have to identify if there is any other organic cause in them. If there is, with some blood tests, as well as most of the commonest investigation is an ultrasound abdomen. We generally ask the parents to get an ultrasound. So in my practice, most of the recurrent pain abdomens which we see, most of the scans come as mesenteric lymphadenitis. So this mesenteric lymphadenitis, where most of the times it is because of the infectious process going on. So this, we start the kids with some medications. They do decrease in the severity as well as the frequent episodes of pain, but and it goes over some period of time, and ultimately one fine day, even the child as well as the parents, they forget about this. Yeah, can appendix pain come and go in kids? Yes, definitely. This appendicitis, as I already discussed, acute appendicitis is one condition where it directly comes with all the red flags like pain, vomitings, fever, and all, so that we can diagnose it immediately and do the surgery and get the child cured. But whereas some pains, which are generally vague pains, and they come and go, and most of the times the parents, they take to the local doctors, they get some antibiotics, analgesics, it subsides partially, but again it may come back within 1 month or 2 months. So this process keeps on going. So this is called as a chronic appendicitis, where again it requires surgery is the gold standard for this. So, what tests or investigations are needed to diagnose the cause of the pain? Is there any advanced technology for neonates? So, neonates generally, recurrent pain abdomen, it is not very easy to diagnose why the neonates are crying, because excessive, they come into a category of excessive cry. There are multiple reasons for that. Sometimes there may be abdominal colics and all, and they generally don't present like chronic abdominal pain, only in the way if there is some few conditions like malrotation, but definitely they present with, in the neonatal period, they do present with all the red flags, and they come in an emergency stage. So it is not very common to see recurrent excessive cry just for the neonates like that. Can constipation cause pain in abdomen? Yes, some kids, they do find it difficult while passing stools, or they, when they pass hard stools, they tend to develop pain in the anal region, and they can sometimes attribute it to the abdominal pain. And most of the times, maybe colicky pains are associated with chronic constipation. What is recurrent abdominal cramps in a child? Yeah, recurrent abdominal cramps are colicky kind of pains which are seen in children. One first most commonest cause is the chronic constipation, and sometimes mesenteric lymphadenitis also cause these crampy abdominal pains. Very rarely, the surgical conditions like malrotations and intestinal adhesions, they do cause such thing, but they come with some red flag signs. So why check CBC for abdominal pain, and can CBC, that is complete blood picture, detect stomach problems? Not really. Actually, CBC can just identify if there is any anemia and any infection process going on. So more likely we can have a general picture of the well-being of the child rather than going to a targeted diagnosis. So one person has asked, my child often puts fingers, toys in their mouth and experiences stomach pain. Yeah, most of the times when kids start to they develop the teeth, they put their fingers in their mouth, and what they take in is the microbes which are in the surroundings, and sometimes worm infestations they do happen. Worm infestations are one of the commonest causes of mild pain abdomen. Not very common, but though we can see this worm infestation, they generally don't cause any much of a severity in the pain. And most of the kids, they are getting dewormed nowadays, so they don't cause much of a problem. So there are no questions. Okay. How to know if child's stomach pain is serious? Yeah. Again, it is the red flag signs. Yes, definitely. Severity of pain, yes. The parents can identify how severe is the pain, and how much their child is in pain. And along with that, if there are red flag signs like vomitings and blood in motions, and having weight loss, and they can find any other like any bumps and lumps in their abdomen, thinking of any cancers. Yes, definitely they are serious, but most of the times they generally are not much of a problem. Should any neonate with feed intolerance suspected not be investigated aggressively? Yes, definitely. Neonates sometimes they do have feed intolerance and lactose intolerance, and aggressively to be investigated not required much, because initially what we do is we can stop these lactose. We can be on the lactose free diet, and if you can see that the baby is improving, then we can consider it as a lactose intolerance. And feed intolerance, there are, it's beyond the subject, but there are feed intolerance a lot of causes, and they can be a gastroesophageal reflux, and which again is a different entity. And generally, as I again told, that neonates cannot identify which is a pain abdominal, but there is excessive cry, and we have to identify whether there is a gastroesophageal reflux or there is colicky abdominal pain. And most of the times, yes, definitely it is a gastroesophageal reflux which causes this. So I think there are no questions, and thank you all. And I would like to say that we at KIMS Cuddles Secunderabad, we are a complete mother and child unit with all the advanced laparoscopic robotic procedures we do regularly, and any children with any other issues also, not only pain abdomen, we have a lot of urological issues and other issues who require surgical care, or will get the world class treatment here. Thank you.